I was concerned about Shirley, and she's diagnosed with bipolar, but she also had diabetes, and she had limited transportation, limited resources as far as like how to cook. She didn't know a lot about the diabetic diet, and she only had a microwave to cook with. I think it was Dana that referred Shirley to me, because she was concerned that Shirley had expressed interest in losing weight, getting better control of her diabetes.
Often people come in to see me or any of the other behavioral health consultants because they are overwhelmed, because they have a lot of challenges going on and lost a way to prioritize. So in Shirley's case, she was really having a hard time prioritizing what the issues was, because they'd kind of accumulated and built up around her.
Well, my life crumbled really bad. I was going from place to place. My marriage failed because of my bipolar, and I was in and out of the mental hospitals because I couldn't deal with life. I was very depressed and a little bit nervous, but mostly depressed to the point where I was hurting, and I was really suffering. I didn't know how to manage my bipolar. I didn't really know why my moods were swinging or what was going on. And people who have a physical illness, the pain is the same, but the pain's in here when you have a mental illness. And pain is pain. You need some kind of medicine and treatment and to get help. And if you don't, it's going to get worse.
So as Nida and I met when she moved here, she's originally from Angola, but she was living in South Africa for a time with her sisters before moving to the US. And so life has taken Asnida for quite a ride. When Asnida came to me with her first pregnancy, that was one of her questions. I'm worried. Will I have a good outcome with this pregnancy? And I was concerned about that too.
Knowing that this country has a big rate of higher mortality among the Black women, for me was one of the biggest concerns, my biggest fear. What if they don't listen to me and I become one more statistics?
Is when she had her first child, and I think several weeks after he was born, started having some episodes where he was struggling to breathe. I remember her coming in and looking scared, and I know myself, the feeling of being scared as a mother for your child. And so I knew at that moment, I had to act, and we were able to get him directly admitted to Barbara Bush Children's Hospital.
When I was in the Coast Guard, the motto was Semper Paratus, always ready. And I've really looked at that and how that applies to healthcare, and really tried to ensure that that's something that we're living up to, is being always ready to meet our mission to serve the needs, making sure that we're providing high quality, equitable access to care, and really ensuring that we're breaking down barriers to healthcare, so that disparities in healthcare are not further detrimental to people that are vulnerable. A lot of that is through the use of community health workers. They're really important to our programming, and also language access. We serve patients in 32 different languages currently, and that's growing. So we serve 13,000 patients annually, but most of our patients, more than half, live in Lewiston.
I always described it as being kind of like holistic, because we have, of course, your medical providers, and then we have behavioral health counselors, and then we have psychiatric nurse practitioners, and there's a couple health centers that have a dental center as well. Plus, we have a social worker who's our connector, and she can help folks get on to health insurance and other community resources like transportation. So that is pretty unique because it's kind of like a one-stop shop.
Maine is actually the most rural state. And so when we think about where our health centers are serving, they're serving the most rural people in the most rural state. The roots of the health center movement are actually really deeply embedded in the civil rights movement in the 1960s. So they've been around roughly 55 years or so now. It started out as part of the whole policy spread around addressing the war on poverty. If you think about multi-generational poverty in Maine, our health centers are helping to address that. If you think about food insecurity, huge here, our health centers are helping to address that. Then you have a lot of folks, particularly in the small rural communities that our health centers serve, who are lucky enough to have access to private insurance, and so they use that to go to the health center.
I knew about our local health center. I had been a patient there for 35 years. When we moved to town, we had 2 boys, and we were looking for healthcare options, and we felt like having somebody right in town was better than traveling to Skowhegan or traveling to Waterville. I think that our community health centers operate as a small business within our local communities. We support 1,500 non-healthcare jobs. You know, the guys that plow, the plumbers, the electricians. The impact, the economic impact in the state of Maine is nearly $450 million in direct community spending.
It always shocks me when I look at the list of where they are all across the state, how many there actually are from one end of the state to the other, and that service is over 200,000 people across the state, which is an unbelievable amount of people.
The interesting thing about the community health centers is that they are providers of choice, but they're also a safety net for those who can't afford to go elsewhere. And that's one of the key things about our community health centers.
When I first came to Maine from Mexico, I was part of the Millbridge community, the Mano Mano community, and my family had received services from Maine Mobile Health. My background is in early childhood. I was always very interested in working with children. Often children of immigrant families or where you don't speak the language, you get really left out. And that's what I wanted to do.
Maine Mobile Health Program is an incredible place that really works to support the whole person. And so part of that involves looking at those basic needs like access to food and clothing and housing, and also thinking about the whole person. So both the medical needs that someone might have, but also their mental health and their social life.
I do think that we are a health center that focuses on social justice, on racial equity, and I want my patients, and I want our patients to feel deserved, that we are here for them, and not just us, but their community around is there for them.
These are the folks that literally do the work that stands behind the symbols of Maine, the blueberries, the pine trees, the lobster.
What I really love is the dedication to mission that health centers have, the vision they have for a healthier state, and the unwavering commitment that they have to the communities they serve. I think one of the things that we're starting to gain some energy and excitement around is not wanting to be the best kept secret anymore, really wanting to say, we're here, we've been here for a long time, we've been marching forward during the pandemic and way before the pandemic, and now we really want to be part of solutions that are contributing to a better healthcare system.
They just said because he was born before the time, he needed time to adjust with the outside and everything, and they did all the testing and they didn't find anything. So it was good to go just to monitor, but then there was nothing wrong.
He's wonderfully healthy. He was able to be treated and stabilized and doing remarkably well.
He's a strong boy. He's bigger than me. Somehow.
I think, thankfully, that had a very good outcome, and Christopher is a wonderfully healthy, happy baby boy, and as Nida is such a beautiful and wonderful mother to him.
Just amazing to be like, I made it, I'm home, and I have my son.
Shirley is phenomenal. She has found ways to advocate for herself. She's found ways to negotiate relationships. She's looking at possible academic programs.
I was at the end of my rope, and they threw me a lifeline by helping me regain me. That's exactly how to put it, is a lifeline. Wow, it's just fantastic. I'm finally getting to me again.
Yes.
You know, I thought I lost me, but you guys found me. Thank you.
The service that we get in Maine because of the community health centers is unbelievable, and we are lucky to have it. And that's why it's really important to me that we have facilities like this. We are extremely lucky to have this model in our state.
The importance of these community health centers in rural Maine is critical.
Para mejorar la salud de los trabajadores temporales de Maine y sus familias,
ofreciéndoles servicios y cuidado médico que son culturalmente apropiados.
We've spent so many years forming relationships with our community, and we know the challenges that they face. And it's a way that we can show our care and compassion and our love for them.
You know, Sarah, I just want to tell you, you are an awesome and a super powerful healthcare provider. And I will be forever grateful for everything that you do for this community and for my family. You make a great team. We do it.
Is it a special calling?
Oh yeah, I definitely think so. Yeah, this is where I'm supposed to be, working at a health center in my community. That's what I'm supposed to be doing.
When you guys took me back, I was like, yes, I'm coming home.